Let's bring in Dr. Neilank Jha. He is a neurosurgeon and a spine surgeon in the Greater Toronto Area. He is in Vaughan, Ontario today. Thanks for this today, Dr. Jha. Your thoughts on this report, surprised or not?
We have a broad challenge here. If you look at the number of Ontarians that don't have family doctors, that number is at 2.2 million and expected to go up to over 4 million by 2026. If you don't have access to a family doctor, it's very difficult to see a specialist. You need a referral. So whether you look at GI, whether you look at orthopedics, spine, neurosurgery, there's a delay in accessing the care. And I think one thing's very clear amongst Canadians when I speak to patients every day is that we're very proud to have a universal healthcare system where there's access for everyone. However, there's a lack of efficiency in the system, which needs to be rectified. If you look at what we have now, similarly, we have the highest cell phone and cable rates amongst the world. We have the highest insurance rates, the highest banking fees, groceries. There's a lack of competition. And similarly in the healthcare system, we have a system that could be restructured to provide better care. For example, right now we have different software, electronic medical records being used by different doctors' offices that are creating inefficiencies. You may get your imaging done in one part of the province, but it can't be viewed in another part of the province very easily. Similarly, each hospital has its own board of directors, their own buying power, their own buying groups. We could use the power of the federal and provincial government to basically buy on behalf of the people of Canada. For example, if you're having an orthopedic procedure or a spine procedure, theoretically, you might be paying $300 for a screw. But if we use the power of the government to buy as a group and not have individual silos, you could reduce that cost markedly and then reinvest into medical schools to have more access to family doctors, into specialists so that there's more operating rooms. It is not as simple as just opening up some private MRIs because the supply chain will be blocked at several levels. So we're seeing these challenges in the healthcare system, despite the hard work of the doctors, the nurses, even the hospital staff. Everybody's trying to do their best, but there's an underlying fundamental challenge with the system itself that needs to be restructured in the interest of Canadians.
What are the consequences when this kind of thing happens, Dr. Jha?
Well, for example, if you take a spine procedure and somebody has significant low back pain and leg pain, or they have spinal stenosis, they can't walk long distances, it's affecting that individual tremendously, their family, they may be the breadwinner in the family. It's affecting the GDP as well because people are not contributing when they otherwise could have. If you're waiting for an orthopedic procedure, you're waiting for a spine procedure, a neurosurgical procedure, you're not necessarily contributing to the workforce. So it's having a detrimental impact on patients, their families, and the entire system. I do think there's an opportunity to resolve this, but everybody would have to work together to restructure the system.
I want to ask you as well, one of your areas of expertise, of course, spinal surgery. What are the wait times like for that?
It's quite extensive. In some cases, to get to the operating room takes many months, and these patients are in extreme pain. So I'll refer to my colleagues that do subspecialty work in the cervical spine or the lumbar spine, and they're so inundated with cases that a lot of times, you really are just taking the emergencies. So one thing our healthcare system is really good at is emergencies. If you have emergency care and you show up to the emergency room, you will get immediate care if it's emergent. Unfortunately, if it's not an emergency, you're sent home and then you're waiting in order for that elective procedure to occur. So we need to do a better job. And as we discussed, if over 2 million people in Ontario don't have access to a family doctor, they're finding it very difficult to access the care. Then once they do access the care, the wait times are extensive. And in my experience, many of these cases are somebody who's the sole breadwinner of the family, waiting to get treated so they can get back to work to provide for their family and their kids.
Yeah, 2 million in Ontario, 4 million across the country. Dr. Jha, it's always good to see you. I appreciate you taking a little bit of time today for CTV to get your thoughts out on this one today.